My role here is I'm an occupational therapist and I specialise specifically within hand therapy. We see all age groups all the way up to the elderly, and within that group we do find that they are using the digital streams a lot more. However, they are struggling as well to get into their appointments, so within that they are reliant on their relatives or friends or public transport, and it makes it very difficult for them to come to regular appointments here. So if we can use things like apps that they can download onto the tablets to assist in the progression, it wouldn't be to replace the therapy, but it would be in addition to, so they might not need to come in quite so often, and it'll just help them to progress. So we can often find as well that coming into the department, or anybody coming into a hospital, they don't always hear everything that you're telling them, and they might take out little snippets but not everything. So what we also would like from the apps is that it backs up the session, it gives them that additional information that they might forget or might not have fully heard, and additional to that, just how often they should be doing it, so they can be using the apps as alarm reminders of what exercise they should be doing within that. So we are currently working with ORCHA in two ways. So they are recommending apps to us that they feel would be useful for us in our department. What we're also doing is we're asking them to review some apps for us that may be used in other local trusts to us, or other people have said to us might be useful. So from our perspective, what ORCHA are doing is they are looking at different streams that we wouldn't be able to get into. So the data security is a big one for us. Also, who is developing the app? Is there actually therapist input into that? Is it a clinical background that it's coming from? And that takes a lot of time, and clinically we are obviously here to see the patients. So yeah, I would recommend any NHS staff to really get involved, to get themselves an ORCHA Pro account set up and see how that then can develop into their area, see the apps for themselves, see the ratings and how it comes together, and then look at how they can take that forward into assisting with their patients in their area.